Hello, everybody. We are now in week 12, which means we only have 4 more weeks left of clinic. So hard to believe that we are here already. Um, Information for both groups. We are passing this message out to students, but if you happen to see this, we ask that you please address it as well. But especially, I think we see it a little bit more with first year students. We don't want them to open their EagleSoft Smart Docs prior to their patient being on campus. What happens is if they open those too early and let's say the patient ends up canceling, well, there's a dated record of that form in the patient's chart, even though they weren't here that day. So once the patient is in the waiting room, it's fine for them to open the docs. They shouldn't fill them out until the patient's in the chair, of course, no change there. But we don't even want them opened until we know for sure that the patient has arrived. You have received an email from Nicole Patel, dental hygienists. The Northeastern Ohio Dental Hygienists Association is hosting a graduation dinner for the second year students. If you are able to attend, please reply to Nicole's email. I'm sorry, this does not include dentists because it is hosted by the Dental Hygiene Association. And we are so sorry. We know it's on a clinic night for first year faculty. Unfortunately, we were not able to schedule it during finals week due to the CDCA exam. And then there's an award ceremony that week as well. Let's see, first year students. We are at week 12, which means lots of instrument skill evaluations are due. So you may get a little rush of those this week. Please do your best to get those completed for students. Of course, we want everybody to get them done and get them on time. However, if somebody has waited to the last minute and you need to do patient care, you need to check somebody in or scale check or polish check so that patients can get completed. It is possible that you may not be able to get to every instrument skill evaluation. It just depends on how many there are and what else is happening in the clinic. So we do tell students to complete things early in the semester so they don't end up in that situation, but it happens. So just sort of do your best. It's not the most black and white thing, unfortunately, but do your best to kind of keep that all in balance. And if you have questions, you're welcome to come to me or to Jen, and we can try to help you navigate that. For the second year students, we are getting positive results on the CDCA OSCE exam. 6 have taken the exam and 6 have passed, so that is wonderful. We have several students taking the NBDHE exam this week and then several more next week. This is also the week that second year students are able to do local anesthesia skill evaluations on each other. So if they have not been able to find a patient to do that skill evaluation on, they are allowed to complete that on a classmate. So you may see that popping up as well this week. That's all I have for you. I hope you have a wonderful week, and I will see you around.